All right, folks, we're going to get started again with our next panel. If you'll come on down. So if the panelists will come up here, we have Senator DeAndrea Salvador, who is the moderator for this panel, and she is online. And our presenter for this panel, Jennifer Rueckel from from Carolina's Collaborative on Climate Health and Equity at the NC Center for Climate Studies, is also virtual with us. But we have the other speakers should come up and have a seat here. I'll go ahead and introduce DeAndrea first, and then she'll introduce the other speakers. DeAndrea is a member of the North Carolina Senate, District 39 from Charlotte. She is a founder of a groundbreaking Charlotte-based organization focused on energy efficiency, sustainability, and DeAndrea works to improve the community's most pressing issues, including climate, clean air, and energy affordability. She believes in making common sense investments in our community. She serves on our board, Clean Air NC, and Youth Empowered Solutions. She was on the Mecklenburg County Air Quality Commission for 3 years. She is a TED 2018 fellow and recipient of the UNC Charlotte Young Alumna of the Year Award. She is an up-and-coming state legislator that we need in there, and we're so happy to have her with us today. DeAndrea?
Thank you so much, and good afternoon, everyone. I wish I could be joining you in person, but I have a number of events and I'm actually about to hit to Canada, but I'm glad that we still have the opportunity to do hybrid events such as these in June. Thank you for that very kind introduction. I actually, in the last couple of weeks, got a new one with the GRIS 50, and I know there have been a number of Charlotte folks who have been awarded the GRIS 50, so I am completely humbled and honored to be in the leagues of them. So I'm really excited about today's panel. I think that this will be extremely informative, and I'm really pleased to help moderate the session to kick us off. So for our presenter, we have presenter Jennifer Rueckel. Dr. Jennifer Rueckel is a trained environmental epidemiologist who serves as a research scientist at North Carolina State's North Carolina Institute for Climate Studies and the Cooperative Institute for Satellite Earth System Studies. Within the academic arm of NOAA, National Centers for Environmental Information, her research is focused on using casual science to rapidly understand how, when, and where local interventions may best be leveraged to reduce climate health inequities in underserved communities. She is a co-lead director of a new NOAA Center, the Carolinas Collaborative on Climate Health and Equity, focused on climate resilience in at-risk communities. So I know that we're going to be in for quite a treat and a delight today. June, would you like me to also introduce the panelists or wait until after our presentation for today?
You can go ahead and introduce them now, DeAndrea. And let me say that DeAndrea does have to leave at 2, and I'll be taking over as moderator. I forgot to mention that. But yeah, go ahead with the panel introductions.
Great. So we have 4 really wonderful panelists joining us today. We have Mercedes Quesada Embed, Associate Professor of Environmental Policy and Advocacy at Catawba College. We have Crystal Dixon, Assistant Professor of the Practice, Wake Forest University. Kirsten Miner, Health Manager of Clean Air NC, Angie Shastas, Associate National Program Director for Air, Climate, and Energy at the U.S. Environmental Protection Agency. You can read more about our panelists on the Clean Air NC website. So Jennifer will be speaking to us today about a new collaboration among universities in North and South Carolina, working to co-develop solutions with frontline communities to protect their health and quality of life from extreme weather events caused by climate change. So I will pass it over to you, Doctor. I'm really looking forward to your presentation.
Thank you so much for that warm introduction. I'm delighted to be here speaking with each of you and to share the spotlight with such an incredible panel of experts. Can everyone hear me and see my screen? Thumbs up. Let me situate mission control. Here we go. Great. So the goal of my brief presentation today is just to provide an introduction to a new center at NC State, the Carolinas Collaborative on Climate, Health, and Equity, established at the end of last year. And then we'll open it up to discuss with the panel and audience members to engage in a dialogue around climate, health, and equity. We are only one of two newly funded centers with the NOAA RISA program, the Regional Integrated Sciences and Assessments. We are kind of following the heels of our predecessors, CISA, and building off of decades of important climate resilience work here in North and South Carolina. NOAA currently funds 11 teams geographically dispersed around the nation to do kind of similar work as us, place-based research around climate resilience. Central to the RISA model is the grounding and regionally focused and interdisciplinary research. The goal of the RISA program is really to expand the nation's capacity to adapt and become resilient to climate change. The work is accomplished through applied and co-developed research with the aim to enhance local decision-making, strengthen local partnerships, and increase the capacity of communities to own and develop their own solutions. The new center is focused on advancing climate, health, and equity here in the Carolinas through community engaged research. These are our three co-lead directors. We have Dr. Dello, our climate lead, the first female director of the North Carolina State Climate Office. We have me, an environmental epidemiologist and research scientist within the North Carolina Institute for Climate Studies. I'm the health lead. And we have Dr. Louis Rivers, who's our equity lead and specializes in risk and decision-making science, who has recently made the transition to the EPA. A central goal of our NOAA-funded center is to partner with at-risk communities who are the first and worst impacted, but who have traditionally been underrepresented or left out of discussions around climate risk. This type of community-engaged research really means that the community defines the research questions is and racism. All right, am I still here? I got an internet connection unstable. Still good?
Can hear you now. I think you cut out for a bit there on my end. I'm not sure for the folks that are in person today.
Okay, but we're good now. Okay, thank you. So of course, we can't talk about climate resilience work without also mentioning the pandemic. The COVID pandemic has really placed the nation's long-standing systemic inequities under a microscope. These inequities have really come to the surface, including unequal availability of testing, particularly at the start of the pandemic, worker protection policies for frontline and essential workers, the availability of vaccines, and even the disproportionate health impact of the virus on low income and communities of color. The southeastern US in particular has been hit hard and repeatedly shown up as a hotspot in national statistics. And we know that these statistics are complicated by political divisions, historical and racist policymaking, government mistrust, and even health system failures across the region. And this is the context in which our RISA is charged to create resilient Carolina communities. It's a new era, and we're going to need a radically new and different way to approach this work. A recent poll shows that people are more worried about climate change now than before the pandemic. There's a growing recognition and sense of urgency about the dangers of leaving climate change unchecked, which makes this a critical time for action at all levels, from local to national and even international. It's a really important time in history characterized by new opportunities for climate action. And in many ways, the pandemic response has created a blueprint for addressing the climate crisis. Our RISA team is working diligently on how to capitalize on this unique moment by bringing together institutions across the Carolinas, including South Carolina State, Clemson, and Furman in South Carolina, and NC State, UNC, NC Central, and even just a special shout out to Max Colley, one of our co-PIs at the Museum of Life and Science. One of the hallmarks of the RISA program is this integrated science approaches. Our team integrates both physical and social sciences into each aim. We recognize that science is lacking when it's performed by homogeneous teams. So one aspect of our work is the inclusion of a diverse interdisciplinary team who, with each investigator being deeply rooted in the communities that they serve. We believe this is just one approach that will help us ask new questions and develop more creative approaches to climate resilience. Our team also includes a solid foundation of climate services and NOAA partners. We have My Institute here in Asheville in the western part of the state, co-located with NOAA's National Centers for Environmental Information. We have North Carolina Sea Grant, the National Weather Service, and even Dr. Dello's North Carolina Climate Office. Justice, equity, diversity, and inclusion is the core and foundation of our RISA Center, and it's built into each scientific aim. As a team, we're regularly going to be asking and answering how do our programs, our research, engagement strategies, even our climate resilience actions impact and benefit tribal nations, low income, and communities of color. We're being held accountable to external partners like our newly convened Community Advisory Board. We're working on convening a JEDI Advisory Board and are going to really be looking to these external partners to help us, do what we say we're doing by integrating JEDI in each phase and each aim of our work. The heart of this work is community engaged and co-developed research. So we'll be seeking to elevate the participation and voices of our most at-risk communities. We'll be figuring out how to achieve these equitable and inclusive decision-making and power sharing strategies with our community partners. We're also committed to the recruitment and retention of a diverse research team plus student cohort with an eye on thematic areas. So we're going to obviously be working to quantify the inequitable health impacts of the climate reality on local And we want to make sure that this new knowledge is translated to action, where the research is used by the community to create more resilience pathways. And ultimately, our big picture objective is to build the capacity to help local communities across the Carolinas develop and own their own solutions. So we're in the first 5 months or so of startup. standing up a new center, getting the processes in place. We're working on how a plan for how we define frontline communities, how we identify and engage with these communities. What, with a special eye on providing funding to our potential community partners at each stage, from exploring a potential partnership to identifying concerns and even starting the work. We are currently working with 3 communities already underway, with a priority towards rural and tribal communities. We've also started partnering with a local justice collaborative and helping to enhance their capacity to do engagement in the age of COVID. And Dr. Louis Rivers is leading them in some mental modeling to help understand the divide between community concerns and local decision making. This group is a million steps ahead of us, and we're learning so much already for them. They're working in the eastern part of North Carolina to help connect neighbors and local response resources in the event of a climate disaster. And they're building resilience through regional resilience hubs from the ground up. We know that the most benefit will happen when diverse members of communities come together and bring their ingenuity and local knowledge to bear, arriving at more holistic and sustainable solutions. We're working to build trust, establish community norms, and build those relationships necessary for doing community engaged research. We're the new kids on the block, and we're not the only group working in this sphere, as Dr. Wilson mentioned. So we heard from Dr. Fry and others from the mapping panel, and a special call out to Lauren Thee and all the amazing work on climate and health equity her team is doing at DHHS. We're working to make those critical connections in the region to not duplicate, but complement existing and ongoing work. As you know, this takes time and requires going out into the community. So work has already begun, and we're really looking forward to working with and learning from our community partners and sharing progress as we advance through this 5-year NOAA initiative. Many, many, many thanks to NC Breathe for making this event possible and creating spaces for conversations around climate, health, and equity in the region. And with that, I will pass it back to Andrea.
Great, thank you, Dr. Rueckel. That was a wonderful presentation, and I certainly enjoyed learning more about the program. So we are now in our panel section. So to our panelists, please feel free to chime in with questions after hearing the presentation. If this turns into more of a discussion, that's wonderful too. But I will get us kicked off because I really not only enjoyed this presentation, but I enjoyed reading the briefing document as well, which was talking about just the inception of the program. And one of the quotes that you used really stood out to me was resilience happens at the local level, but communities need help turning data into action. And, that really resonated. And I know you all are just in the beginning phases of starting to work with communities, but are you starting to already even see ways in which this may start to take place? Or do you have ideas for ways in which you all will, and I know you touched on this a little bit in your presentation, but ways in which you're going to help to turn that into action for communities?
Yeah, I think maybe historically and on the climate science side of the house, we've led with all the data, the really doomsday stats and the urgency of climate change is here and now, and we're all gonna, we're all in trouble. I think we're kind of flipping that message on its head and leading really with, here's how climate is impacting your health and well-being, both now and in the future. And that's a really great framing or messaging tool to help communities on the ground make those critical connections. And not only is, using the health lens to communicate about the effects of climate change a tool, but it's also a really unique way to measure our progress and ways that we can intervene to safeguard the health and well-being of our most vulnerable, and even monitor and measure progress as we begin to implement some of these resilience strategies. So I think that's one way that we're hoping to kind of help communities turn data into action.
Great, thank you for sharing. So I will turn it over to the panelists. I cannot actually see each of you individually. So feel free to just jump in and share your name, and I'll try to engage best as possible. But we can turn it over to the panel now.
This is Angie Shaddis, US EPA, and I represent the research arm of EPA. And I wanted to react to something that Jen said, and also Shakobi Wilson earlier, and that is how research is often, in the past, been for the researchers, and as Shakobi says, extractive. So how do we turn that research into something that is not extractive, but brings a solution, as Jen said, a solution back to a community? And I know that there are many dimensions in research, but I recognize a lot of similarities between the struggles in academia and what we're facing in the federal research front. And that is that we have been trained often as atmospheric chemists or epidemiologists, and we think in terms of journal publications. And so what we're doing at the EPA, and I know that many other institutions are doing this too, thinking about how we can train ourselves as scientists to also think about how to engage a community, how to bring solutions back to a community in ways that not only help inform the body of knowledge for other researchers, but that build on a community's needs and give them some concrete actions. So I just want to recognize that that is out there, and that I see that we all struggle with this. And I feel like we are very lucky at EPA to have brought over Dr. Louis Rivers. Jen mentioned him. But people like Louis Rivers are helping us to think about the social science aspect in conjunction with the climate science and atmospheric chemistry and modeling that we do.
Hi there. I've already got the laryngitis going on, plus the echo. It really makes it a little bit spooky. My name is Mercedes, and you know, I'm thinking back to Jimmy Melvin's presentation earlier today, as well as Richard Moore's keynote, and there's so much that we're hearing today about involving and engaging the community, but I think that we need to remind ourselves of the real circumstances that the communities are facing, not only with regard to the ecological components, but too close. Better. Not only with regard to the ecological components of environmental justice and injustice, but the economic circumstance that is very real. And the economic circumstance of today demands a time commitment to one job, maybe two jobs, maybe three jobs, time commitment to family. And so I think we have to be careful when we sort of come to communities and say, we want representation, and we want it to be authentic representation. So you're burdened with the problem, and find us a solution. Right now you're burdened with the solution as well. So we have to be cautious in the ways in which we sort of ask for that engagement and encourage the engagement, and be really sensitive to exactly what those real life economic justice and injustice circumstances are, and not let that fall to the wayside. Because time is a real factor, and family commitments and work obligations are a real factor for individuals. And so sometimes I think it's easy to say we need to engage the community and hear the ways in which they're going to be able to make contributions to data pools and information that we're going to be able to draw from. But I think we also have to think carefully about what are the ways in which we can facilitate that engagement, not just ask it, facilitate that engagement, and in so doing, ensure that we're not further burdening communities that already have the historical, institutional oppressions burdened upon them, but to be kind of doubly tasked with the burden of the solution.
Thank you for those comments. And this is Crystal Dixon here, Wake Forest University. I think we all have kind of beaten the dead horse knowing that we have to look at a systems thinking approach for anything. And when you look at the system, particularly as what was just mentioned from Mackenzie here, that, you know, we got to look at the funding sources. Who's funding the projects, right? So I was invited to be part of the Robert Wood Johnson Anti-Racism Consortium. What we're doing is Robert Wood Johnson is looking how to change their funding streams. Who's getting the money? What are their repercussions on if you're not spending the money correctly? It's an anti-racism framework that they're using. And they're forcing people who are applying to actually have pre-established relationships. But not only that, there's a racial analysis involved with what the work that they're doing. So when you start to kind of a little bit control the purse strings, a little bit of what you can do with the money, it starts to make it easier for a lot of institutions to actually adhere to that, and or it filters out those who are not ready to adhere to that. So I think when you go to the root source as the funder, you know, where's the power source, and is actually the funding. And so I'm excited to see that Robert Wood Johnson is looking to do some things a little differently.
Is there anyone else on the panel that would like to do an initial round?
I'll make a brief comment. We keep hearing the word equity, equity, equity. Really, equity did not become the language until 2020 when the pandemic hit. And I'm aware that many institutions have adopted equity and JEDI principles, justice, equity, diversity, inclusion, into their standard operating procedures, et cetera. And, you know, we say awareness is step number one, because if we're aware of the problem and we keep showing what's always been there, but now people are forced to actually look at it, it can lead to action. So I just want us to all be mindful, and I'm glad that Crystal mentioned in regards to the Robert Wood Johnson Foundation is looking at going to the source of, as we move forward with funding different equity programming, et cetera, making sure that it's going to appropriate sources. And then I would even challenge organizations to really take a hard look in the mirror, and whether it begins with staff, but furthermore, looking at yourself as an individual. Are you just checking a box because that's the good thing to do now, because of political clout, essentially? Are you doing it because generally as a human being, from a humanity standpoint, it resonates with you and you recognize, whether it's morality, that at the end of the day, regardless of race, class, we're all human beings. We all need clean air. We all need clean water, clean soil, and we all should have, you know, the right to, you know, live the healthiest life as much as possible. So I will challenge organizations as we move forward with the use of language such as equity and justice. It's great, but really get to the core root as to why you're doing what you're doing, because I think if we're aware, that will obviously influence how we proceed forward as individuals, but instead of the individuals as community, essentially. So that's it.
Thank you. And again, as being on here, if someone is already starting to speak or anything, just let me know, because I certainly don't want to cut anybody off. But I know we've heard a lot of really poignant and insightful comments, Dr. Rueckel, one of which kind of goes into, one, what does engagement look like? You know, what is that starting to be like in action? So maybe you could paint a little color into some of the initial engagement and things that you're seeing in the early inception phases. And then the other one about funding, you know, are there stipulations for the funding and things of that sort? I think that would be really interesting to hear for the purposes of this program. And, you know, of course, it's different depending on the funding source, whether that's coming from the government or an independent funder, or maybe even an individual, and what stipulations they set. But those are two things that, you know, seem to be emerging things from the panel that I certainly would love to hear your take on as well.
Sure. No, and for the last comment about equity, I do completely agree. I know on the health side, we've been looking at health disparities and focusing in on all the deficits that are, you know, within a community. And I think when you think about health disparities, it's a little bit of a new push looking at racism and other structural barriers that these communities face and addressing them. Not all individuals, that we understand that it's the social conditions from which individuals are born into, grow up in, work, and live that's influencing health and well-being. And ultimately, we can quantify and measure the impact of the environment or those social conditions on health and well-being, but we have to do something about it. And I think that's where economics, job opportunities, and hiring community members to actually, who are representatives of the community and from the communities that you're working with, hiring them to facilitate engagement and be doing on the ground. They know the key gatekeepers in their communities, and I think it's really important that we think about how to create and foster economic opportunity in these communities as a first and foremost, which is outside of what I do as a health professional. I think as far as an engagement, again, we're so early into this. It's almost like we shouldn't be talking about it, but we've been partnering with the tribal community and we're already learning so much, right? That's ultimately what we do as researchers. We listen and we learn. And from the tribal community's perspective, resilience is something that you plan for over 7 generations, 100 years. And you incorporate the feedback of your local government leaders, as well as all members of your community. And so we've set forth, we're in the first round of a 72 document IRB tribal approval, but we're working to make sure that we're incorporating the voices of the government sector leaders who are wanting to kind of have an all of government approach where they're prioritizing climate resilience in all their decision making, as well as from the community's perspective. What are those pain points? What are those concerns? How are youth conceptualizing their future in the context of a climate crisis? So some of what we're structuring around community engagement, is deeply going to be grounded in these community members' voices. As far as funding, we absolutely agree that extraction is not our goal and that we can't tap community members for their insight, for their local knowledge without compensating them for their time. So we have funding to fund this community work. We do want to hire community members who are going to be facilitating engagement and working kind of on the ground as we kind of move through the multiple phases. NOAA is, I can't speak, for NOAA, but they are learning and wanting to learn more about how to kind of fund this important work, because ultimately the Academy has all the funding and that's where a lot of the resource and power is. And so NOAA's looking to learn how to move away from that model, but they're kind of in the early stages. And so I think after this 5-year cycle, there will be some new insight and maybe even some new funding strategies coming down the pipeline. And with that, maybe others from the panel have.
Thank you. And before we jump into that, I just wanted to thank everyone for the opportunity to sit in on today's panel and to moderate the beginning portions of the session. As June alluded to, I do have another meeting I have to run to, but I really enjoyed the bit of time that I could share with you all today. So everyone, please take care. And with that, I'll hand it back over to the panel. Thank you.
Thanks, DeAndrea. Okay, other comments from anyone up here? We have lots of time left and we'll have questions from the audience, of course. Kirsten.
So I'm glad to, Jen is still there, okay. So I'm glad to hear in regards of not just involving community members, compensating individuals in the community, because going back to what Mercedes was saying, that oftentimes we go into these communities and we want them to be involved, but oftentimes it's volunteer work and they're juggling so many responsibilities as is. So I do think it's important to provide compensation, but also when we speak about compensation and building capacity in these communities, a question that I kind of have that I'll just, it's an open-ended question, is speaking to how can we make sure that, at the end of this 5 years, whether it's a grant or stipend, things of that nature, how can we build capacity in these communities to make sure that when these institutions leave, to move on to another, project and things of that nature, the community is not left out hanging dry because they no longer have that main facilitator in that respective community. I think that's important because when we speak about community ownership, compensation, create a sustainable system for that community within that 5-year span so they can continue to advance it as they see fit when those entities do leave that respective community.
And I'll jump in on that. And I'm glad to hear Noah is struggling with this funding thing too, because EPA is. And we have certain, we have laws that we have to follow when we conduct a research study. And we are working through the aspect of compensation for individuals. It may look differently depending on the community. There's not really a one-size-fits-all, but I think we all agree that if someone is contributing time and their talent, they should be compensated. And to the aspect of leaving a community, nobody wants to leave a community in the lurch. We also have timelines for our own funding and, frankly, for administration priorities. So what do we do? How do we build? How do we start from the onset? How do we develop something that can grow? We can nurture it. We can start it. It's going to be the communities. How do we leave with sufficient capacity? Do we partner with an existing institution in that community? But how do we build this up so that when a federal agency or some other agency leaves, that the work continues, because it is so important. So those are things that I think sounds like I know all federal agencies are struggling with. I know that we are talking about it quite a bit at EPA because we are happy to have an administration that has a renewed focus on environmental justice. And we absolutely want to capitalize on the moment and take the fullest use of it.
I agree with those comments, Angie. And I wanted to take a moment to share with you all. You probably saw all over the news that in Winston-Salem we had a Weaver plant fire that happened for about a week, maybe a little 5 days or so. Oh my God, the students were in panic. Parents were like pulling their kids out of school. They were like, we got to get them out of there. And I said, this is 5 days of potential exposure to ammonium nitrate. Can you imagine a lifetime? Can you imagine a lifetime? And what I'm saying is, I think it's just fascinating how we have this dance of what we should do. We need the community's expertise, and it's common sense. The problem is the reality is we're looking at groups of people, and we don't value them. And we're not really willing to reconcile that truth. And that is what's making this appear to be like some wicked problem, which in some respects it can be. But the reality is we have, as a country, have got to do an introspective look, as Kirsten was saying, and reflect to see what is really going on with my perceptions, my lens, my implicit biases. What role am I playing in this? Because it's not rocket science. We know what to do. You pulled your kids out of school immediately. You got them to safety. That's what we're asking to do in these communities. And that's why it's frustrating to talk about research and all this, because it can be a distraction when the reality is the answers are there. So I'm just trying to figure out when are we going to actually have a moment of truth and say, listen, we as a country have got some work to do internally first, which is why the anti-racism movement and all those trainings are happening, are, relatively effective if you're open to the content, because the work is easy. It's just getting people to safety. So I just wanted to mention that, because equity, while it's important, it's temporary. Justice is what we need, the changing of the systems. And I think equity, we can get stuck there and try to fix the problems temporarily, but not fix the actual issue, which is the systems and the way this country is unfortunately set up to maintain power. So I just wanted to mention that. It's just a humanitarian issue, and we have to really reconcile with that. Thank you.
Thank you, Crystal. If I could jump in on that as well, I think that there's, we use the term climate resilience. And when we think about resiliency and we think about climate, oftentimes we go to these sort of three options, right? We think about climate offsets, and we think about climate mitigation, and we think about climate adaptation. And in reality, what we're asking communities to do is to adapt, right? And we're not actually asking this pressing question of how do we, by design, now undo the oppression that was built in by design. And so what we're saying to them is adapt along. Yeah, you might get another refinery, but here's some strategies to handle it, right? What about not getting the refinery? What about stepping back and looking more broadly at what these true challenges are and where they're birthed and why they're birthed in the way that they are? And so I think there's something to be said about not only looking at the individuals that are in these communities that are suffering, but looking to the institutional factors that are really driving so much of this, and think about more mitigative measures. Think about mitigative measures before the communities are hurt, before the communities are further harmed, before the children draw images like the ones we've seen in the PowerPoints, right? That's really the crux of the matter, is getting ahead of this, and that means undoing so much and unlearning a lot. And we do have to be willing to do that work. And that is the collective we that Richard Moore mentioned. That is all of our work. Those more privileged with more opportunity and those that have not yet had those opportunities birthed into circumstance, as DeAndrea was saying. So, I think we really do have hard questions and hard realities. And some feel that more than others, but really getting and stepping back and saying, let us design something different, right? I love this quote by Frances Moore Lapay. She says, how is it, it's a question quote. She says, how is it that as a community, right, a large body of people, we have collectively built a world that individually we disagree with? How is that possible, right? We don't agree with it individually. Who do you meet that doesn't want drinkable, swimmable, fishable waters? Very few, right? And so the reality is we all individually want something better and know that we can build it. We've built this system, economic system, political system, healthcare system, education system, and they're all flawed, and we know we can do better. So let us build systems that are good. We've built systems that are flawed, and we know the flaws. We see them. Let us build something better, redesign.
Great comment there. Rebecca? Jennifer?
Next. I think just to follow up on that really incredible point about the collective we, ultimately the community engaged research that we want to do will spur collective action and, motivate political will, and that translates into effective policymaking. One model that we're hoping to rely on with our center is to partner these more under-resourced communities with more resourced, affluent communities as allies and advocates, because we know that at-risk communities often share the similar hazard geography with more affluent communities, and the development and regulatory decision-making upstream from these upstream communities often have direct impact on downstream communities. And we think that's one model for affecting local and more systemic change. Sorry if I interrupted.
Fine. Do we have questions from the audience?
We do have a few from online.
Okay.
So the first question is from Yancy Fauci. Yancy, I apologize if I just butchered your name. Appreciate Mercedes' point about not increasing burdens while seeking better attempts at representation. Would any panelists weigh in with some specific strategies that might be useful to that end?
I think the question was thinking about that idea of authentic representation that I raised in my earlier comment. Are there ways in which we can kind of envision that playing out without burdening people, but giving people the space to still have a voice in the process and feel as if they're a part of that stakeholder engagement, but without the burden?
Well, I feel like that collectively, we know where we want to be in the future. We want a better world for our children. We want a better world for our neighbors. How do we get there? The science, the research that we all do can help us chart a path towards a better future, whether it's reliance on renewable energy over fossil fuels, whether it's more walkable communities. How do we get there? We have to change the laws. We have to change the way we think about where we site things, how we zone. And getting there is the hard part. There are a lot of people that we have to bring along, and I'm also going to say that we have a problem in this society with scientific facts. How do we communicate them so that everybody, we're trustworthy? I don't know if that answers the question, but that's my thoughts.
So I'm putting on my public health hat because I heard multiple things. Public health at the root it's preventive, not reactive. We don't wait until disaster or tragedy to take action. We do our best to be proactive. So if an event or situation was to occur, going to the resiliency piece, this community is not completely devastated. Going back to kind of looking at our society, it's power. It comes down to power. If you think about the pyramid, instead of, at the very top, the trickle-down effect will benefit the greater people, inverting the pyramid, so it's upside down. So at the top is community, and that small percentage is that, who typically has all the resources. It's not just being harvested to just that 1, 2, that small percentage, because the power is within the people. It's within the community. And I think that our society is we're individualistic. We need to get back into being community focused. So when I think about solutions, and it goes back to what Richard Moore spoke to last night, actually, at the student town hall, is when you have community, let's say that, in a community, there's children that has to be raised. Childcare is a big barrier for a lot of families, whether you're single parent. Childcare is very expensive now in our society. If there are, adults in a community, whether, parents or not, if you're aware that your neighbor, maybe could use a couple of assistants. I grew up in a neighborhood where if my mom was baking a cake and we didn't have milk or eggs, I could knock on my neighbor's door and they would lend us milk and eggs so we could bake that cake. And I knew everybody in the neighborhood. If they were traveling out of town and they needed a house sitter or someone to look after their pets, I actually grew up in a community where we trust each other to do that. And I think that, unfortunately, the pandemic, a lot of people are scared of each other now. We don't want to be close to each other. You have to physically distance yourself. And it's valid. I'm not going to say get in people's faces, but we need to, in due time, and understand as people feel more comfortable, because we're going to be looking at the repercussions of this pandemic we're living in a study right now. But trusting your neighbor, get to know who your neighbor is, because if we can lean in on each other, then a lot of things can be accomplished. I don't know how in a world we can shift that, but, instead of being in competition with each other and wanting to be, this is what I've accomplished, as an individual, we have to get back into that community space, because if we do look out for each other, a lot of these barriers that we speak to could actually be removed. It just requires us to not be selfish. And that's kind of it. Like, just really take a look in, stop being selfish, get with each other.
Thank you. I think we have one more question.
Thanks for this great conversation. I'm Melissa Malkin-Weber with Self-Help Credit Union and the North Carolina Clean Energy Fund. You all work with communities all the time, and it's kind of an article of faith that the best solutions come from the communities who are living with the problems. And I'm wondering if you've got any favorite examples that you can share of great solutions that you've seen and worked with.
So prior to being a professor at Wake Forest, I did a lot of community work in Durham County, so I was excited to see Bull City in the building talking about all the amazing innovative work they're doing there. But one example, which is tangentially linked to environmental justice, is part of this group called the Greensboro Health Disparities Collaborative. And part of that collaborative is full of community members, scholars, academics, so on and so forth. And there was a disparity between black and white breast and lung cancer treatment completion rates. And a community member realized that they were getting different quality treatment. So when Richard Moore was talking about not compartmentalizing different issues, they're all related, she realized she was getting less quality of care. Not the same referrals, not the same quality, not the same, everything was just low quality. And she called and convened and interviewed professors from UNC Chapel Hill. Jeannie Ang, you may know her, Dr. Jeannie Ang, was one of the co-founders of the collaborative, and literally brought together a consortium of individuals who we still meet today and I'm a part of, and literally addressed the issue by creating a systemic intervention that changed the healthcare system in Guilford County. So we literally changed the system with the leading of a community member who had an experience, led in a community-based participatory research approach, which is shared power, as you know, and literally changed the entire outcome, not just for black patients in the study. Black and white patients benefited. So now we're traveling over the country, sharing with other folks, MD Anderson being one, and of course Wake Forest, but everyone's trying to figure out, wow, a community member had an experience, literally used her influence and pulled on institutions, said this is what we need to do, led in that, and of course we're struggling with who gets the credit and what institutions are running around saying we did this, and it was actually the community. But that's I hope that helps to answer the question. That's one example, and I say it's related to environmental racism because lung cancer, as we know, is generally linked to environmental racism.
Thank you, Crystal.
Catherine C. online asks, how do we empower those affected the worst by environmental stressors? And I think a lot of that question has been answered already, but she follows up and asks, is there a central link at the NC state or federal level for engaging our youth and local communities in collecting needed data in defense of safe air, water, and land? Understandable, is there a place that, I'm extrapolating here, is there a place where it is made understandable for a layperson ally and student mentors? Does that make sense?
If I could jump in really quickly, I'm not a part of the NC State system, as the question was directed, but I just want to mention a little bit of what's happening here in Salisbury, Rowan, with regard to this question and the previous, with regard to kind of the solutions that surface and sort of come into being and this connection to the youth. So here, there are many that are working on community gardens locally and engaging K through 12 kiddos in those community gardens. And there's a lot of food insecurity here, a lot of what we tend to call food deserts in some of the academic world that really has been recategorized by Soul Fire Farms executive director, Leah Pennyman, who's written a great book called Farming While Black, and says, you know, they're not food deserts because the soil is fertile. They're food apartheids. It's a political choice to not put a grocery store there. It's a choice to not allow people to have something other than like a little quick stop shop. And so these children in our community here are working with an organization called Happy Roots and some other groups in town that tend to partner with her, like Horizons Unlimited in some capacity in many of our public schools. And children are leaving school some weeks with 30 pounds of vegetables that they get to take home. So creating fresh food pantries for those families that are very insecure. And a lot of that really is touching the youth very, very directly and is coming from the youth very, very directly. And so as that comes up in that turning over of the triangle, right, as that comes up into the local kind of governance structures, they're now thinking about creating a position for a county-wide garden manager. And so that's another good change that would come to Salisbury, Rowan, and really help to tap into the food insecurity issues that young people and the community are feeling.
Thank you, Mercedes, and thank all the panelists for your responses and your vision and your inspiration for us. Thank you, Jennifer. Rueckel, for your presentation. This is a good segue into our youth panel. So we're going to ask Madison from our staff to come up and the other youth that are with us.